Okay, now it's recording. Okay, Krista Keller is a Colorado native and a graduate of UC Boulder. She became interested in Medicare solutions as an occupation while pursuing a master's degree at Regis 13 years ago, and learned about the need to help educate people in the complexities of Medicare. And there are some, and to help folks navigate through their plan options. She soon became a full-time Medicare specialist, helping people sort out their options. She really loves what she does and is a resident of Lone Tree in her spare time, which nobody in this business has any of this time of year, enjoys traveling around the world with her husband, Jeff. Connie Ward, Connie, operates her Medicare advisory practice under the name of Optimal Aging Medicare Solutions and has nearly a decade of experience in her field. She's licensed in 17 states and with several providers, including United Healthcare, Humana, Cigna, Anthem, Aetna, Kaiser, Mutual, and SilverScript, and serves about 1,000 clients today. Like Krista, Connie also enjoys helping people and takes the time to understand each person's unique Medicare factor profile. Also works with a number of community partners to help them with their business needs, which may include medical professionals, financial advisors, insurance brokers, and very active in several organizations that support older adults in Colorado. Jennifer Hansen, who is struggling to get in, I guess, but I'll go ahead and mention her. She's the owner of Helping Hands Consulting. She has 13 years of long-term Medicaid experience, using her passion to help people understand and determine the often complex process of long-term Medicaid eligibility. And speaking from experience, I can tell you that it is complex. Jennifer's experience includes a multi-year term as a long-term care specialist at the Department of Healthcare Policy and Financing, which is the Medicaid agency for the state, and has worked to interpret and implement Medicaid policy there for a few years, and has also worked with a lot of county departments and human services. So she started Helping Hands Consulting in 2010, and has helped over 4,000 people obtain long-term Medicaid. Okay, and we'll put that contact information in here. So the way we're going to do this today is I'm going to ask our panelists some questions, and they're going to provide excellent answers. And if you folks have questions along the way, please put them in the chat. And there may be time for some verbal questions at some point. We'll just see how this flows. But in the meantime, if you put them in the chat, that would be the most helpful way to do it. And I'm going to start out with either Krista or Connie, whichever one of you would like to take this one. Is Medicare only for people over age 65?
I'll go ahead and answer that. So no, Bob, actually, Medicare is a federally financed program that is available for people who are 65 and older or who qualify with a disability. Sometimes you have to be on disability income for 24 months in order to qualify. And with other disabilities, you might qualify right away.
Okay, thank you. Okay, so let's say I'm over 65 and I'm still covered by an employer health plan. I'm still working. Do I need to enroll in Medicare? And if I do, won't I be paying twice for healthcare coverage?
And I can take this one. So you actually would have the option to delay your Medicare. And Medicare says as long as you have what's called credible group coverage from the time that you're first eligible for Medicare until the time that you would transition into Medicare. So that in some cases is sometimes only several months, other times could be several years, but as long as there would be credible group plan in force during that entire time, there would be no penalties or issues transitioning into Medicare.
Okay, thank you. So I pay, of the government a premium, and I can say this because I do, a premium each month for Medicare. So why do I need a Medicare supplement? Tell me what that's all about.
Good question, Bob. So you are paying a premium for your Part B, part of Medicare, but your Medicare A and B come with deductibles and co-insurance that leaves you financially vulnerable. So you typically want to look at a Medicare supplement plan or a Medicare Advantage plan to offset the cost that Medicare does not cover. Does that answer your question?
I think so, yeah. Does Medicare have any income restrictions?
They do. So Bob, the premium that you mentioned for 2021 is the standard premium, $148.50. But sometimes there are going to be situations where people who are make more income than that will actually pay a higher amount. So that information is listed on Medicare's website. Connie and I also have that information. So we are happy to get that to anybody who would be looking for that information. And basically what happens is Medicare looks back to 2 previous tax years to see what the return would be to determine what the Part B premium is. So let me give you an example. For 2022, let's say you were concerned about having an income adjustment. You would be, what Medicare would be looking back to is the year 2020, because that would be 2 previous tax years, and whether you file individually or as a joint return, they will look at that return amount. And then if there would be adjustment made at that point to the Part B, then that would be where you could locate that information on the chart to determine what your premium would be adjusted to. And so the good news is sometimes, like, I've had clients that have maybe had a spike in income, like they sold a property. So for that 1 year, their premium goes up, but then the following year, their premium would go down. So it can certainly fluctuate from 1 year to the next.
So what I'm hearing then is that if you have a capital gain, for example, selling a property, then that counts as toward the income that increases your premium.
It would, yep. So in that case, maybe your premium would increase for 1 year, but then kind of go back to the normal rate thereafter.
Okay, but it doesn't increase your supplemental coverage premium. That has nothing to do with income. Is that correct?
Correct. Yep. The supplemental and the Advantage plan premiums are actually determined by the insurance companies. Supplement plans are usually determined more based off of where you live and also your age. And then Advantage plan premiums are going to be more standardized. So it would be just based off of what the insurance company agrees to charge the entire Medicare population for a particular plan.
Okay, thank you. So this is something that there's a lot of misunderstanding around, and that is in-home care. So does Medicare pay for in-home care?
So you're right, that is a confusing topic. In-home care can be either medical or it can be custodial, caring for somebody who can't function with the daily activities. The medical component can be covered. So if a doctor orders home health care, which is basically rehab at home, where you have maybe an occupational therapist, speech therapist, or physical therapist, or a skilled nurse come to the home, that might be covered by Medicare. But to have somebody come in for custodial care would not be covered by Medicare.
So when you say custodial care, are you talking about like activities of daily living, that kind of thing?
That's right.
Okay.
That's right. Those are out of pocket coverage. So you would be paying for that out of pocket.
Does Medicaid cover in-home care?
You know, that's a really good question for a Medicaid expert. Is she on?
No, not yet. We'll come back to that.
Krista, do you happen to know off the top of your head?
Sorry, I was unmuting the wrong area. I was having an audio problem before, so my apologies. So typically Medicaid does not, but there are some areas, like there are areas where some cleaning services are available, and some other, I think we'll just have to hear the specifics once she's able to get on. But there are definitely some areas for people who qualify for Medicaid that are going to be covered a little bit under Medicaid.
I think you're onto something there, Krista. I have a client, this is Phil with Answers for Senior Care. I have a client I just visited yesterday who is on Medicaid, and they are receiving hours of care at home for activities of daily living. It's all kind of set up through their social worker, whoever that is, to figure out what it is that they're actively able to receive in terms of help. So.
Yeah, and I think there are some restrictions on the number of hours as well each month. Yeah, I think it's like 8 hours a month.
That's right.
Okay. I see occasionally when I watch commercial television and I see commercials, I see commercials from celebrities advertising Medicare. So if I call that number on the screen, what happens?
Please don't. No. Really, most of those ads that you see on TV are solicitations, and you do end up getting a national or sometimes even international representative. So they don't know the local markets. Truly, the purpose behind those is to get people to call in. You'll end up on their lists for a very long time. And a lot of times the purpose is for the agents who are working there to get a commission by switching your plan. People like Connie and I, what we do, we're local. We know the local plans. We know the local networks of doctors. We know the benefits. So we're happy to evaluate that with you. There are changes in Medicare, and it is good that that information is out there right now, especially this time of year. But it is overwhelming, and you do, want somebody who is a trusted source to truly help you decide which plan is going to be a good fit for you. With Connie and I both having over 10 years of experience in this area, we'd be happy to help out, but we just really caution you. I have clients that have called me and just told me, I called into that number a couple years ago, and now, I still receive calls almost daily. And we all know there's a lot of scams out there, and it's really quite unfortunate. So, we, again, just kind of caution you on that, and happy to be a resource. And I know Bob will be posting our contact information.
Yeah, and I would just like to add to that, to what Krista said, is that if you think about it, the only way that these people get paid when you call them is if they switch your plan, right? They're not getting paid to help you, and they're not getting paid to answer questions. They get paid to switch your plan. So it's really important to understand the purpose of the call. They also can sell your contact information to other organizations. So that's another thing to just be a little bit cautious of.
Okay, thank you. I mean, I know I'm getting solicitations from new Medicare providers every day. I mean, people, companies I've never heard of. So it's crazy. Next question. Doesn't Medicare pay for nursing homes? Connie, Crystal?
I can answer that one.
Okay.
The way that I kind of describe the cost right now, if somebody is living independently, they are paying for the roof over their head and the food on their table. And anything that would be medically related, as far as surgeries, hospital stays, anything like that, Medicare plans would cover, whether that's through a Medicare and a supplement or through a Medicare Advantage plan. If someone were to move into an assisted living or a nursing home, their medical coverage will still be in place. So they'll still be able to see doctors, still have hospital and emergency care and prescription drugs, all that good stuff. But they will not have Medicare paying for their living costs. So they will still be responsible for the roof over their head, the food that would be maybe provided by the facility.
And I think, let me add to what you're saying, Krista, because I think this is important, because Bob's question could somehow be confusing. But you asked, does Medicare cover cost of nursing homes? There's a very distinct difference between nursing home, also known as skilled nursing, rehab centers, those kinds of things versus assisted living. So, but I think Kristen nailed it in that if it's medical related, then Medicare will cover it. They don't cover housing costs, and that's the point.
Yeah, thanks, Bill. Okay, the next question here is, our family has to pay for a nursing, well, let's talk about assisted living first. So are there any circumstances where Medicare would pay for assisted living? Any circumstances?
So just as Krista was saying, no, if it's necessary, it'll pay for the medical expenses associated with it, but not for the living conditions, for the living cost of living, meals, housing, any of that.
And that's where I also think, once we kind of start getting into the Medicaid conversation, that'll be important because a lot of times the purpose for somebody to try to qualify for Medicaid, a large part of that could be to pay for living costs because they're not able to afford the high costs of a nursing home or an assisted living facility.
That's right. Hey, Bob, I think you're muted.
Does Medicare pay for memory care facilities or for hospice or for respite care, any of those things?
This is Connie again. So does Medicare pay for hospice care? Yes, your Medicare Part A pays for your hospice care. For memory care, again, it'll pay for the medical aspects of being in a memory care facility, but not the living, the cost of living. So it's not going to pay for your rent, your room. It's not going to pay for your meals. It will pay for any type of medical services you receive.
And
I'm so sorry. I just was gonna ask about how does that usually divide out?
Well, there's a room charge in a memory care facility. You have your room chair, your daily activity charges, your room charges. Then the doctors and nurses who visit are going to be billing the medical insurance separately, completely divided.
By the way, just again, for clarification and definition, memory care places fall under the assisted living category. If that helps people understand. So memory care is an assisted living environment, but it's typically set up for folks in a secure environment where safety becomes an issue for them leaving the building, exiting, as we call it, exploring.
That's correct, Phil. And typically with assisted living, you're going to have this continuity of care model of pricing, where depending on how much care is needed, if they're independent living, you'll have a lower cost for assisted living. And then all the way up to the high, what do you want to call it, high contact memory care type situation is going to be a higher cost. But again, that is borne by the family or the individual that is receiving or living in the facility.
so would it be fair to say then that if you have a loved one that needs to go into memory care, the chances are really good that the bulk of the cost of that care is going to have to be paid privately?
That's
Yes.
correct. That's absolutely right, Bob. Having just experienced that in our own family, like I said, everything is delineated. You pay for the living environment, for the meals, and then when any type of medical services are rendered, the insurance company is billed directly by those providers.
Thank you. So Jennifer, have you joined us? It kind of looks like maybe you did.
Yes, I'm here.
Oh, there you are. Okay. Good morning. So this is Jennifer Hansen, who I introduced earlier. So, so you got on just in the nick of time. So we had some questions earlier about Medicaid and nursing homes and assisted living. So can you talk a little bit more about how Medicaid, what Medicaid pays for in terms of nursing homes, and then also assisted living?
Yeah, absolutely. So there is a program, a Medicaid program called long-term care Medicaid. And when someone's eligible for long-term care Medicaid, it will pay for care in the home, assisted living, or nursing facility. And just because it's a government benefit doesn't mean anyone's going to come in, and dictate those levels, but it will pay for all of those levels of care under that long-term care Medicaid category.
So it'll pay for nursing homes and for assisted living, both.
Assisted living, yeah, or home care. Yep. If someone wants to try to stay in the home a little longer.
And there are, I assume, some kind of income or asset qualifications that go along with that.
Yes. All Medicaid programs. So although Medicaid is one word, it's not one thing. It's a bunch of small little Medicaid programs. All of the Medicaid programs are going to have financial criteria you have to meet. So with the long-term care Medicaid, if you're looking for Medicaid to apply, or to take care of you for the assisted living, home care, nursing facility, they look at income and assets, to determine if you fit in their box, so to speak, and they're willing to pay for, your care under that long-term care Medicaid.
And so what are those numbers?
So the income limit for long-term care Medicaid for 2021, obviously that's going to change here shortly, is $2,382 per month. So $2,382 per month. And they're only looking at the individual that's applying for Medicaid. So for example, if you have, John that's applying, he needs assisted living care, but he's married to Jane, they will not consider, they're not looking at Jane's income in that calculation, just John, the individual that's applying, to determine if he makes $2,382 or less. Now, the clarification I want to make here is under long-term care Medicaid, if someone makes over $2,382, they can still be considered income eligible for long-term care Medicaid, but they're going to have to jump through some few extra hoops. And the reason being is because Medicaid is aware, just because, and somebody makes $2,500 a month, so just a little over the income limit, doesn't mean they can afford $9,000 a month in nursing facility care. So they are still willing to consider those individuals to be income eligible, but those individuals have to do a few extra things. They're a little complicated. I won't go through all that today, but just know that it's still a possibility. The assets, so the asset limit, my answer for that is it depends. If you're a single individual applying, the resource or asset limit is $2,000. If you're a married couple and both of you are applying for Medicaid, it's $3,000 total for the couple. If you're a married couple, both applying, and you are sharing the same nursing facility room, it's $4,000. But the most common one we see actually is the situation in which, you have a married couple, one is applying and the other one's not. So go back to my example earlier. You have John that needs long-term care Medicaid, but his wife Jane is, in the community, still doing fine, living independently. So in that situation, you're just applying for John. The resource limit for that case is a total of $132,380. And so what I also want to clarify is that, what does that mean? People talk about this resource limit. What does that mean? I always say vision a bucket. You have to tell Medicaid about everything you own. They always want to know about everything, and they always want a lot of information about everything too. But once you've, verified everything, again, go back to our bucket here. In terms of the resources, they're going to take some of those resources and count it towards that bucket. And some resources you told them about aren't going to count in the bucket. All right. But whenever Medicaid tallies up what's in your bucket, that they count it, that your bucket cannot runneth over. Okay. It cannot exceed the resource limit associated with your case, which what is that resource limit? You know, again, it goes back to, it depends on the situation. So for a single individual, his bucket can't exceed $2,000, you know, and so on with those other examples. But that's essentially what the resource limit means. When they add everything up, it can't exceed the resource limit associated with your case.
So Jennifer, this is Phil. I have a question for you. So is the rule that I learned from you still valid, that basically somebody that's applying for Medicaid can still own a car and still own a house?
Yes.
That's accurate, right?
Yeah. So talking about the bucket. So great question. So you have to tell Medicaid about the car. You have to tell Medicaid about the house. But when they are determining, you know, what counts in your bucket, one car, a household can have one vehicle that doesn't count in the bucket. All right. Most houses don't count in the bucket if it's a primary residence. You know, there's always a few exceptions to that, but I'd say the majority of primary residences don't count in the bucket.
Thank you.
Another question, Jennifer, on the income. So does Social Security income count toward that $23.82 a month?
It does.
It does.
Almost, I'd say 95% of income sources count towards that income limit. There are a few small ones that don't, but income is usually fair game towards that limit.
Okay.
And that's Social Security income, whether it's Social Security retirement, Social Security disability, SSI. Well, SSI is actually one that doesn't count, but like VA. So if you're receiving a VA pension, you know, a compensation type pension, that counts towards the bucket as well. The two that really don't count towards income are SSI and the aid and attendance portion of your VA income. All right. So for example, if you're getting $1,244 total from the VA, and a lot of times people may refer to that all as VA aid and attendance, but in all honesty, there's a behind the scenes calculation, and a portion of that's actually VA pension, and then a small portion is aid and attendance. So you have to get that breakout from the VA, and that whatever portion is aid and attendance doesn't count towards the income, but the VA pension does. So really, other than the aid and attendance and the SSI, almost everything counts.
So when you say SSI, what do you mean?
Supplemental security income. So it is a Social Security based program for people aged or disabled that make less than about $794 a month. So it's very financially based. So for example, if people start getting Social Security and they only make $500 a month, they may be so that if they apply to Social Security and get SSI, is the supplement to that. So Social Security would pay them their retirement of the $500, and then the SSI would make up the difference between the $500 and the $794. So they would then turn around and get an extra $294 a month from Social Security through that SSI benefit.
So you mentioned earlier that, you know, Medicaid is not one program. It's how many programs is Medicaid?
Yeah. Well,
long-term care piece.
Yeah. Yeah. So Medicaid, and, you know, I kind of mentioned this earlier, it's one word, but it's not one thing. You know, what this one word actually is all these little small Medicaid programs. And typically each program, for the most part, is out there to target a specific population of people. So there's one that really targets families and children's. You know, there's one that really targets individuals when they become disabled before they're 65, you know, and they need their Social Security benefit, you know, sooner. They need healthcare sooner. And, you know, then you have long-term care Medicaid for individuals who need assisted, you know, care in the home, assisted living nursing facility. There's about 6 main programs, but then there's multiple kind of sub programs too, so it can get very complicated. But I find you know, I'm not going to sit here and go through all the programs, but this is what I want people to know is that is the number one reason why there's so much misinformation in the world about Medicaid, is because, you know, I have people call us all the time and say, well, I asked this person what the income limit was and they told me this, and then I looked online and I found this. Like, who's right? And here's the thing is that they're all right. They're just all talking about a different Medicaid program. Okay. So if you're asking about the one that targets family and children's, those have specific income limits associated with that program. You know, the long-term care, and they're going to be different from the ones with long-term care Medicaid. So you have to be careful if you're doing your own research, that you're really trying to research the Medicaid program that you're considering. You know, like I said, I specialize in the long-term care Medicaid. So that income limit I gave you earlier and how it works with how they look at it if you have a spouse or whatever is just for the long-term care Medicaid.
Okay.
Which is exactly why I always refer to you.
Thank you, Bill.
Yeah. So in other words, Medicaid's complicated.
It is.
The other thing that I'm aware of with Medicaid, you know, and that's the Healthcare Policy and Financing Agency within the state government, is that agency is the biggest agency in the entire state government. They spend the bulk, by far the largest share of the annual state budget goes through that agency. And it's because of all these 34 or whatever the number is, Medicaid programs that apply to all different classes of people. So it's a big and very complex area.
Yeah. And I'll add to that, Bob, about 60% of the total budget that comes out of there is for long-term care Medicaid. So long-term care Medicaid recipients usually are about like 20% of what's covered, but it's the majority of the cost, you know, because it's so expensive.
And you said earlier, a nursing home is around $9,000 a month. Is that true?
Yeah. Yeah. In the Denver metro area, you're looking at around $9,000 a month.
And that's for double occupancy rooms, is that?
Yes.
Oh,
Yeah,
so there's
that's for a shared room. Correct.
in my private room.
Yeah. A private room is going to run you a little, I would say between 10,500 and 12,000.
Okay. Do you, well, this is, I guess, a matter of opinion, maybe more than fact, but there's Medicaid quality healthcare, and then there's private pay quality healthcare. Is there a difference in the quality of the healthcare depending on who's paying for it?
You know, I think I feel like there's a reason, you know, years ago where that there may have been some truth that there was a discrepancy there. But I have found that a lot of research that's been done recently by some reputable organizations actually find that you get the same type of great providers and good quality care under Medicaid as you do other insurances. In all honesty, if my mom moved here tomorrow from Mississippi, I would actually, if she needed a nursing facilities that take Medicaid, I would place her in one of those over some of the private pay only ones. So it's very interesting. I think it's just a matter of kind of knowing, you know, being familiar with the facilities, you know, and finding the right doctor, right? I mean, you know, you can go to any doctor and regardless of who's paying, maybe he may not be the best, but it won't be because someone's on Medicaid. So I think a lot of it's just doing your research, but yeah, you should get the same quality care under Medicaid. And I always tell our clients and families too, in a nursing facility, because sometimes they're private paying and then they convert to Medicaid and they're worried they're going to get less care. I always tell them the people taking care of you in that nursing facility don't know how you're paying. You know, they don't know, you know, that you had a payer source change. All they know is that, you know, the care they're supposed to be providing.
And that this opens up a question also for Connie and Krista on a subject of maybe not just the quality, but the availability. So I've been hearing off and on over the years that some docs just don't take Medicaid patients. Some won't take Medicare patients. Can you all talk about that a little bit more? Give us a little more perspective than what I can offer.
Yeah, I can go ahead and take that question. So, you know, with any doctor, they get to choose what they do and don't want to accept. So some doctors accept everything, Medicare, Medicaid, private insurance. Some doctors will work with only one insurance company and that's it. Some doctors will only work with government programs like Medicare and Medicaid. So it really depends. What I've found over the years is that it seems like fewer and fewer doctors, specifically here in the Denver metro area, are accepting Medicare, like straight Medicare, just because the billing to the government is quite a process. And it seems like what I've found is as time goes on, billing private health insurance companies can sometimes be easier for doctors. So sometimes that can actually be an area that looking for having the private health insurance company as a primary can be beneficial. Whereas in other areas, I'm licensed in several other states and, areas like Arizona and Florida, because there's such a high retiree population, a doctor would not be very smart to not take Medicare because, everybody's on it. So it really just kind of varies, kind of a case by case situation. The other thing to keep in mind too, the combination of Medicare and Medicaid can sometimes be a challenge with doctors because it's two different government entities that are having to be billed. So that sometimes can be a challenge. And a lot of the private health insurance companies, I'm sure you have all seen ads on TV, have come up with what are called dual plans, which dual meaning Medicare and Medicaid, and they're actually designed for people who are on Medicare and Medicaid. And what happens in that setup is that the private health insurance company is actually primary, and then Medicaid is the secondary insurance. So the doctor bill setup would be the private health insurance company as primary, Medicaid as secondary. So we would just need to double check to make sure doctors accepted the private insurance and then also Medicaid.
So how would a person be on both Medicare and Medicaid?
I can start or actually, Connie, you go ahead and answer that, and then Jennifer could maybe finish up.
Sure.
Okay, very good. So you can have a person who is eligible for both Medicare and Medicaid. They're eligible for Medicaid based on their financial resources, and they're eligible for Medicare based on either their age or qualifying with a disability. And so they are what is called a dual eligible beneficiary, being eligible for both. Did you want to add anything to that, Jennifer?
No, I think you said it well, unless Bob, you wanted me to say anything else specific.
Not unless someone has a question. Does anybody have a question that, you can just speak up if you do. That'd be fine. Okay. All right.
I had a question earlier. This is Carly with Amazing Care. I was wondering, what are some of the diagnoses for Medicare for someone to receive kind of like long-term, I don't want to say custodial care or custodial services, because I know that we provide a lot of long-term Medicaid, but I know that there are times that we provide services to people on Medicare for like maybe a diabetic or something like that.
I can answer that one. So usually something would have to be medically necessary for Medicare to cover it. So for example, Medicare itself doesn't cover much on podiatry, but if it was something that was medically necessary and the doctor said, as somebody with diabetes, for example, or as people get older, they are not able to care for their feet. So sometimes some of the private health insurance companies will actually add that as an additional benefit to the plan. And also a doctor could say this is something medically necessary in terms of care and then recommend that. And then a lot of times that would just be coordinated through home health care on the Medicare side.
So it would be from the doctor saying this, and then Medicare would consider covering it based off of that.
Yep, exactly. So that would either be Medicare covering it, or if there was a private health insurance company in play, then the doctor getting in touch with the insurance company to say, this is medically necessary for somebody to come in and help out with, maybe it's speech therapy or, just a number of different things that could be.
Okay. Great, thank you.
While we're on the topic of insurance coverage, I wanted to ask a little bit more about, I guess I would call it original Medicare as opposed to having supplemental plans. Is there any reason for anyone who's eligible for Medicare to not be on a supplemental plan?
Are you lumping Medicare supplement plans and Medicare Advantage plans together when you ask that question?
Yes, thank you. Yes.
Okay. Yeah. Well, a lot of people choose not to enroll in a supplement or a Medicare Advantage plan, either for a lack of financial resources on the supplemental side, because there's a monthly premium that you pay for a Medicare supplement plan, or they may not be aware that Medicare Advantage plans are available in their area at zero premiums. But in all honesty, in terms of financial resources, if a person has Medicare, original Medicare, and they probably want to look at having extra coverage somehow, and a Medicare Advantage plan with a zero premium may be the best solution for somebody who is financially strapped in respect to premiums. But generally speaking, no, there's no reason not to have additional insurance, because you're financially exposed if you don't.
And by having that supplemental or advantage plan, I would assume then it helps with the doctor deciding to take you on as a patient, because it's easier for them than going through original.
When you look at enrolling in either a Medicare supplement plan or a Medicare Advantage plan, it's really important that you take a look at your doctors and specialists to see what they take. So you want to make sure that you are enrolling in the right type of plan for your own specific situation.
And with a Medicare Advantage plan, which you said is zero cost, zero premium, that is, that then comes with some deductibles for certain types of medical care. Is that accurate?
Good question. So Medicare Advantage plans that have a zero premium, they typically don't have a deductible associated with them for medical expenses, but they will have co-pays or co-insurance depending on the service that is rendered.
Okay.
Okay.
All right. Thank you. I want to jump back into to Medicaid again for a second. So for Jennifer, is there an open enrollment period for Medicaid like there is with Medicare?
There is not. You can apply for Medicaid at any time.
Okay. And this is a really good question for you, since this is what you do. Is it possible, is it advisable rather than possible? Is it advisable to plan for qualifying for long-term Medicaid, long-term care Medicaid?
It is advisable. Medicaid has, long-term care Medicaid has what they call a 5-year look back period, which basically means from the day you submit the application, they care about everything you've done with your money 5 years prior to that day. And really what they're, looking at is if you've given any of it away. Did you have a house that you gave to your son, or even put him on half the house? Did you have a car that you weren't using that you just gave to your grandson and didn't charge him anything? Why? Because we love grandson. Why would we charge him? The IRS said that we could, gift a certain amount and not be taxed. Medicaid actually cares about all of those things if we've done any of those things in the last 5 years. So, it's really important to maybe sit down with a professional or an attorney, more than 5 years from when you think you're going to need Medicaid to start doing some planning, to possibly protect some assets.
Okay. All right, thank you. I heard a term this morning too, and we kind of touched on this a little bit earlier, but it's spend down assisted living. So can you talk about that? What does that actually mean? Spend down assisted living in Medicaid, in the context of Medicaid?
Yeah. So a lot of assisted livings here in the Denver metro area don't take Medicaid at all. All right. But for the ones that do, most of them require, again, like you said, a spin down is what they call it. And basically what that spin down time period is the amount of time that assisted living wants the individual to be able to private pay before they go on Medicaid. So with assisted livings, they don't quite get reimbursed as well by Medicaid, as some other providers do. And the assisted living says, hey, we take Medicaid, and we're happy to bill it, but we need to be able to collect that private pay amount, that higher amount from you for a certain period of time before we can take that cut in reimbursement. So each facility is going to be different, right? Some have spend down requirements of as little as 6 months. So all that means is you have to private pay for 6 months before converting to Medicaid. Some have private pay spend downs up to about 3 years. And again, that's the amount of time they just want to bill you privately before they're willing to bill Medicaid for your care there.
Okay.
Jennifer, this is Connie. I have a quick question regarding that. Is it dependent on the facility itself, or are there any income situations that would determine what that spend down period looks like?
It all depends on the facility itself, totally itself. And in all honesty, it can even depend, you could be talking to a facility, and if they're totally full, with the wait list out the door, and you call them and ask them what their spend down requirement is for Medicaid, they may tell you 3 years. They only want people who can pay 3 years before they go on Medicaid. But, 2 months later, you could call that same facility, and if they possibly have had a lot of discharges, have a lot of open beds open, they don't have that wait list anymore, you may be able to negotiate that spend down requirement and may, bring it down to a year or 2 years. Yeah, so there's definitely a little bit of negotiation that can be done, but it definitely varies per facility.
Okay, thank you. So I have a question for Phil, because Phil, you're in this business of referring people. So do you keep a list of assisted living facilities that take Medicaid?
Yes.
Okay. And are there very many?
There are several, but it's obviously not something that they're going to put a shingle out front and say Medicaid taken here. I mean, it's not something that they do. As Jennifer talked about earlier, they're getting about, anywhere from a third to a half of what they really need to survive. So it's a pretty minimal program, but I do have a list of places that I work with that are spend down situations like Jennifer was talking about. So it all depends on the situation in terms of the level of care and the kind of place that's required. But there are a number of them around. And unlike what Jennifer said earlier, I would respectfully disagree. A lot of the Medicaid places are not the nicest places in town. I wouldn't, of course, ever put that in writing professionally, but I'll tell you that I am pretty picky about places when I'm looking for my clients. So.
Okay, thanks, Phil.
And I do have a question, if you don't mind, Bob. Is it okay?
No, that's fine.
My question is for Jennifer, relating to programs. I know what you do at Helping Hands Consulting, and you do a wonderful job with several of my clients who've been very thankful that they've worked with you. So I do have situations that come up where certain places, assisted living places in town, will only take InnovAge as opposed to Medicaid. And so my question to you is the whole InnovAge conversation is a different conversation, probably for another Zoom, Bob. But my question is, when someone's on Medicaid and they've already been approved, how difficult or how easy is it to convert them over to an InnovAge situation? Because some places, like I said, only take InnovAge as opposed to Medicaid.
Mm-hmm. So in order,
while you're answering that question, can you also talk more about, give a little more background for people who don't know what InnovAge is, what they do?
Yeah.
Okay.
So InnovAge is essentially a joint venture between Medicare and Medicaid. They basically came together and said, hey, look, we're paying out a lot of costs for long-term care. Maybe if we come together and create a special program, and the purpose of that program is going to be to keep people in the community, to keep people out of nursing facilities. And so if we provide this great community program, then maybe, it'll be better for individuals and it will reduce our cost. That program is called Program for All-Inclusive Care for the Elderly. The acronym is PACE. That's what people call it, PACE. The PACE, and so PACE is the program, but depending on the service area, there's different providers for PACE. In the Denver metro area, the provider is InnovAge. In the Boulder area, it's True PACE, TRU. So for someone to be, so basically if you apply, you have to be on the long-term care Medicaid, not just any Medicaid program. Remember I told y'all there's a bunch. So if you're already eligible for long-term care Medicaid, then it's pretty easy, Phil, to convert it over to InnovAge. So basically what you're doing is you're taking this, your long-term care Medicaid benefit and your Medicare, and you're changing it over to the PACE program. So to InnovAge. So InnovAge will be your new quote unquote insurance. And it's like I said, it's Program for All-Inclusive Care. It is an all-inclusive thing. So they usually have a PACE center close to you. You will see your doctors there, have your therapy there, your dentist will be there. They have adult day centers there, but it is also, they will pay for your assisted living, if you're on the InnovAge. I find, Phil, that, because typically if you're already on long-term care Medicaid, to switch it over to InnovAge. So again, the InnovAge is like an insurance. So they do want a lot of information about healthcare, your health history, prescriptions, things like that. And then they also are going to want some additional information on the long-term care Medicaid. Like they usually want a copy of the case file you submitted to long-term care Medicaid. They want to make sure they have, maybe the approval notice received and things like that. I mean, in a perfect world, I would tell you it should take no more than about 30 days from the time you make contact with InnovAge.
Okay.
Thank you. That's awesome. Thanks.
Thank you.
Can I say one more thing? I'm sorry.
Yeah, go ahead.
But with the InnovAge, Phil, InnovAge, since it's insurance, they only enroll the first of a month. So, if you don't get them everything, and they do literally enroll through like 5 p.m. on the calendar day before. But if you don't get them everything until, November 2nd, then you're going to have to wait until December 1st. You've missed the enrollment for that month.
So the idea behind the PACE program really is to postpone or eliminate the need for going into a nursing home.
Correct.
Basically, yeah.
Yep.
And so when we see these InnovAge vehicles running around Denver, what they're doing is picking up people either from their private homes or from an assisted living location and taking them to the PACE center for their care for that day.
Yep.
Okay.
Exactly.
And the other thing that's worth knowing is that a lot of people think, well, I can just sign up for InnovAge, but it is very much zip code dependent. It's not in all areas. For example, it's not in Douglas County at all, as far as I know.
Okay.
Yeah. So what you find if you have someone going, looking for an assisted living, and you're, one of the things, I guess, when you're putting someone in assisted living, do we have the appropriate payer source for it, right? Do we have enough money to spend down, get to the spend down requirement, or do we already have Medicaid? Do they take Medicaid day one? That's just a conversation you're going to have with them. You do find, as Phil said, some assisted livings only take Medicaid, some only take InnovAge, and you do find some that take both. But if they only take InnovAge, really what that means is you still have to apply and successfully get through the long-term care Medicaid process. Then you will enroll in InnovAge the first of the next month, hopefully. So it's still a possibility. I think people don't realize it's like the best way I can explain it is it's like a special Medicaid program. It's just InnovAge. So it doesn't mean that if someone is on Medicaid, that assisted living is not an option for them. It just means they have to change their Medicaid to InnovAge or the PACE program associated with their area, and then they can get in that facility.
Sounds so simple.
No, I don't think so. I have a question. This is Melanie up in Jackson County, so we don't have InnovAge or whatever. We don't have any assisted living. We don't have any home health care. So I have a young man that I'm power of attorney for who is presently living in Minnesota in an assisted living facility. He wants to come back to Colorado. That's where he's from. And it's my understanding that Medicare is a national program, but Medicaid is with the state that you are going to reside in. Is that correct?
Yeah, I mean, I would say that's overall pretty correct. Although Medicaid is a federal program, it's administered by the state, since the states are, putting a lot of taxpayer dollars
Money.
into it themselves. And so they can decide how they want to do it. So big picture, if he has Medicaid in Minnesota, you're going to have to, and you need obviously him to have Medicaid here. Then
Right.
once he gets here, and you can always prepare a little bit in advance, but yeah, you will have to totally start all over and apply for Medicaid here in Colorado once he becomes a Colorado resident.
Okay. And how long does
None
it
of the
take to be?
information switches over. Minnesota doesn't send their file to Medicaid. They have no communication tool at all.
Right.
It's a totally and separate, thing.
How long before they're a Colorado resident?
They become a Colorado resident from a Medicaid perspective the day they step foot across the state line with no
Okay.
intention to return where they were before.
Okay.
They don't
thank
need to
you.
have a driver's license, or anything like that.
Yeah, he doesn't.
They just literally need to step foot over with no intention to go back. And I think the difference, so a few scenarios with that. So if he, if he's here on a vacation, right, but he has, he still has his stuff in Minnesota and he was just only here for a week and then something happened to him while he was here. Well, that needs to go through Minnesota Medicaid. He's still a Minnesota resident. If you say, okay, pack up all your stuff, come on, we got the U-Haul, the day that U-Haul comes across the state line, because we've already packed up everything there, and I guess even if you haven't packed it up, if it's the move, you know what I mean? He knows for sure this is the day he's not coming to here and never going back there as a resident, he would become a Colorado resident that day.
Okay. He
So
does.
let me add one more thing, ladies.
Okay.
And Jennifer, please correct me if this is not right, but my understanding, Melanie, is that if he is on Medicaid in a different state, in this case, Minnesota, you would need to be able to show proof that you canceled that insurance in Minnesota as a prerequisite to apply for Medicaid here in Colorado. Is that correct?
Yeah, I'm not even sure he's on Medicaid there because the nursing home says he owes about $15,000. And I'm trying to figure out if he was on some kind of assistance, how that type of a debt would have accrued.
Got it.
So
You got
I
some-
don't know if anybody ever applied for Medicaid for him out there.
Okay.
Yeah,
Thank you for that question.
but I can still answer that question, Phil, if
Yeah,
you'd
go-
like, even if it's not pertinent to this situation. Yeah, I mean, if you have someone coming across in another state that has Medicaid, you do want to notify them right away that you're no longer just use this example since we're talking about it, a Minnesota resident. So they would cut off your Medicaid and you can get it here. Now, a lot of counties, that is their practice, is to try to get that cut off first. I have appealed a lot of those determinations when the counties tend to want to either hold up the decision by that denial or delay Medicaid's effective date by that denial. And I've won all of them at the state level. Our contract with the federal government here in Colorado says that we have to take care of our Colorado residents, period. And they become a resident the day they step foot over. So it is something to be mindful of and try to do. But if there's an issue with that, it is appealable from a Medicaid perspective.
Well, he does have a property here, but it's not in his name, but it's where he used to live. And so I wondered if I could use that address and start paperwork, but his actual physical person has to be here probably, right? I mean, legally.
As a professional, I need to tell you yes.
Okay.
But
Yeah, because he has that address, but he's not physically living there right now. So thank you for your help.
Okay, thanks, Melanie. And thanks for answering the questions. And thank you, Phil. I'm going to turn back to Medicare for a couple of questions for Connie and or Krista. If you could talk a little bit about the different plans with Medicare, because I know they do change periodically. Some go away, some new ones come on. So can you talk about that a little bit, please?
Sure. So there's two different types of, or that's essentially three different types of plans that you could add on to your Medicare. There's Medicare supplement plans, there's Medicare Advantage plans, and prescription drug plans. They do change from year to year. It's always good to contact a local broker to discuss your current situation and see what the landscape looks like. When you said that some go away, I think maybe you're referring to Medicare supplement plan F.
Yes. Yeah, that one.
Okay, that one right there, right? So F as in Frank is a Medicare supplement plan that covered all of the deductibles and co-insurance associated with Medicare. And it didn't actually go away. It just isn't qualified for Medicare after January 1st of 2020. If you qualified for Medicare prior to that date, you can still get a Plan F. It's important to know, though, that they are getting very expensive. The rates are going up on those significantly year after year, so there might be better options out there. But plans do change from year to year, and it's really wise to talk to somebody every year to take a look at what that landscape looks like.
And I've heard different things about Medicare enrollment. So the primary one is there's a magic date in December when you have to have enrolled in Medicare. But the other one is that there are chances to enroll in Medicare after that date. So can you all talk about that too?
Sure, I'll be happy to just kind of run through some of the enrollment periods. So what we're in the heart of right now is Medicare's annual enrollment period, which goes October 15th through December 7th. So people who are already on Medicare, this is a very important time because you might be locked into your plan. In most cases, you will be locked into your plan outside of that enrollment period. So changes that take place right now, the new plan would kick in on the 1st of January. There is a small enrollment window that's not readily advertised or really talked about, but I kind of call it like a get out of jail free card between January 1st and March 31st. For anybody who is on a Medicare Advantage plan, they do have the ability to make a one-time change. So they could change from one Medicare Advantage plan to another Medicare Advantage plan, or they could switch from a Medicare Advantage plan back to original Medicare and add on a supplement plan. So that's just one other enrollment window. And then as far as others, for people who are Medicare, Medicaid, I know we've talked about that a little bit today. There is a year-round enrollment period for folks who are in that situation, or folks who qualify for the low-income subsidy, also known as extra help. Every quarter, somebody who qualifies for LIS or Medicaid or both actually has the ability to change their insurance, meaning that they could change to one plan January through March. And then if they didn't like that plan, sometime in second quarter between April, May, and June, they could change it again. So that's known as a special enrollment period. And then lastly, another one I just wanted to cover is another special enrollment period for people who move. I know we talked about that a little bit with the Minnesota question. So if somebody, I mean, we all know everybody's moving to Colorado, right? Medicare does actually require them to change their insurance within 63 days to the new zip code. So if somebody is moving from Texas and has a Medicare supplement plan and a prescription drug plan, they would have to update that to a Colorado plan. Or if somebody's moving from Florida and they're on a Medicare Advantage plan, they would have to update that to a Colorado Advantage plan. So those are just examples of special enrollment periods, but kind of for the mainstream, everybody else, this annual enrollment period in the fall is a really important time because for the most part, you would otherwise be locked in for the rest of the year.
So Krista, let me just add to that what you were just saying, because this comes up with me as well. Sometimes when people are moving from their home to an assisted living, that's considered a life-changing event, and they would qualify as well. So
Correct. Yeah. And Phil, that's a great point. Sometimes I'll run into somebody who will move into a facility like what you're talking about, and maybe there's a rounding physician that doesn't accept their insurance. So that would actually trigger a really good, to your point, life-changing event and special enrollment period that they change to an insurance plan that rounding physician would accept. So absolutely, we run into that all the time. People moving even within the Denver metro area, maybe they're living in Aurora. Their doctors don't work with, or they have a doctor in Aurora, but then they move across town to maybe the foothills, and they need to change doctors, and all the doctors they're running into don't work with their insurance program. So then that would trigger an enrollment window that would allow them to make a change within that 63-day window of that move.
I love these time periods, 63 days, it's like, okay. Well, be interesting to know how somebody came up with that.
Not to worry, Bob, it might be 65 next month. You never know.
I think I actually figured it out in all the years I wondered it too. I think it's because July and August both have 31 days, and December and January both have 31 days. So they want to give you 2 months, but sometimes those 2 months can be closer to 63 days. But I agree, it was a very random number.
Okay, all right, thanks. Does anyone on the call have any questions of our panelists? As I'm fresh out, so if anyone else has any, please ask.
Bob, one thing I did
really
want
appreciate-
to
I appreciate the panels. You guys are awesome. And ironically, my company is called Answers for Senior Care, but I don't have them all, I tell people. So that's why I need you guys.
So you should rename it to Some of the Answers. Okay, so you were going to say something, Krista, sorry.
Yeah, I actually just wanted to go back to one of the questions that was at the very beginning, asking if Connie and I represent any long-term care insurance carriers. I personally do not, but thankfully I am surrounded by so many great people and professionals. So one of which is actually my husband, who is a financial advisor. So I usually refer my clients who are looking for long-term care coverage to a financial advisor like my husband, who can help out specifically with that. And Connie, if you want to maybe answer on your side.
No, I'm in the same boat as Krista. I don't offer it myself, but I do have plenty of resources who do.
Well, when you mention long-term care insurance, there aren't too many carriers that actually offer that, are there?
I think they're pretty limited in scope, and they've changed a lot over the years. Back in the 70s and 80s, there were some fabulous long-term care plans out there that didn't require a whole lot of premium and paid unlimited amounts on the backside. My mother-in-law was a beneficiary of one of those, which was fabulous. But anymore, you really want to take a quick look at, or a really careful look at what the premiums are and what any maximums are on what they're going to cover. And as Krista said, talking to a financial advisor to help you through that process is probably the best way to go, because you do want to have, make a really careful analysis of, what it might cost to self-fund rather than buying a plan like that.
Okay, thank you. And speaking from personal experience, I have long-term care insurance, and so far, fingers crossed, the premium hasn't gone up. So it's been steady for the last several years. But you do have to get a physical to get long-term care insurance, and they don't take everybody. So, it's kind of a mystery about sometimes who they take and who they don't. Okay, so if we don't have any more questions, I want to thank our panelists. You've done an excellent job of answering the questions and filling in information. I've put all the contact information for all three of these folks in the chat. So if you have further questions, or you are interested in talking to them about your insurance needs or your Medicaid planning, in the case of Jennifer, you know where to go and who to contact. So
I don't see it in the chat, Bob. Did you push send or whatever yet?
Yeah, I did.
I just see some questions.
Was it 12:02? So if you go up a little bit in the chat, maybe you'll find it. I can do it again.
I have one at 11:48 and 11:54 and 12:08 that says @Bob, thanks.
Oh,
But I
okay.
don't see names and contacts.
Let me do it again.
Thank you.
Sure, no problem. Okay.
Thanks, everyone. Have a great day.
Okay, thank you, everybody.
Thank you.
Please spread the word
Have a
about
great
it,
day.
Colorado. Tell your friends and neighbors about us. Okay, thank you.
Bye all.
All right, bye-bye.